For our first-time listeners who may not have heard my show before, I've been as this helm at the radio station here, KFYI, for a long, long time. It's about 1991, 1992, so you're looking at 30-some-odd years, and I'm here to bring information that you don't normally get. A lot of this stuff is hidden from you. The healthcare industry doesn't want you to know about it. Big Pharma doesn't want you to know about it. And the AMA doesn't want you to know about it. Because if you're your own doctor, in other words, if you have knowledge, you don't get sick as often. And if you do get sick, you get through it easier. Because the motivation is to load you up on medications as you get older. I can tell you that. When I went on Medicare, I'm 69 years of age right now, I had more doctors tell me I need to be on a statin drugs. And I'm going to share with you an article in a minute here from Medscape that may open your eyes to a few facts when it comes to the medical community. Now, I've got some great doctors around me. I mean, my good friend, Dr. Zudy Jasser, who's running for Congress in the Congressional District 4, is one of the best doctors you ever want to meet. Cares about people. But there's a lot out there that, they don't necessarily fall in a category. It's about money. Now, I'm going to share this information with you so you have something to base this on. I had more of them tell me I need to be on a statin. And because I know this information, I was able to argue against that fact. Here's my numbers. I have 193 cholesterol, 34 triglycerides, my HDL, which they call the good cholesterol, 85. My blood sugar, or glucose, is 79. I have a PSA of 0.13. 0.13. I'm sorry, 0.12. I take that back. Those are incredible numbers for a man my age, or for any age. But to tell you need to be on a statin drug? So when I throw these things at it, don't you think my lipids, they're great. Then what do I need to be a statin drug for? Which is one of the top-selling drugs in the history of this country and the world. And here was what they said. It's good for you. Well, how's it good for me? I get great lipids. Oh, yeah, great. Your lipids are great. How's it good for me? Because this particular drug could increase your risk of developing type 2 diabetes. They try to hide that. And if you're a type 2 diabetic, it can progress the disease. In other words, get you on more medications. You don't want that. Because about 85% of type 2 diabetics, what do they die from? Cardiovascular-related diseases. Coronary artery disease. You also have an increased risk of what? Alzheimer's. Did you realize that statin drugs cross the blood-brain barrier, lowering cholesterol, decreasing your cognitive abilities? What is Alzheimer's? What's dementia? Decrease in cognitive abilities. So I try to bring you information to help you make decisions. And I'm not telling you by listening to Dr. Fitness, you're going to get off all your medications. I'm telling you the need for them goes down. And when the need goes down, you take less of them, saving you money. Because there's many of you out there who are taking truckloads of drugs. Many of them used to treat the side effects from the medication you're presently taking. This is from Medscape. Drug device makers paid physicians $12 billion with a B in just under a decade. $12 billion paid to doctors, your drug makers, and your device makers in the past decade, just under a decade. A review of, this is from Medscape now, a review of the Federal Open Payments Database found that the pharmaceutical and medical device industry paid physicians $12.1 billion over nearly a decade. Almost two-thirds of eligible physicians, 826,313 doctors, received a payment from a drug or device maker from 2013 to 2022. According to the study published online in the Journal of the American Medical Association on March 28th. Overall, the median payment was $48 per physician. Orthopedists received the largest amounts of payments in the aggregate. That's joint doctors. $1.3 billion, followed by neurologists and psychiatrists at $1.2 billion and cardiologists at $1.29 billion. Geriatric and nuclear medicine specialists and trauma and pediatric surgeons received the least amount of money in aggregate, and the mean amount paid to a pediatric physician surgeon in the top one-tenth of a percent was get this. The mean amount paid to a pediatric, that's a kid doctor, surgeon in the top one-tenth percent was just $338,183 over the 9-year study period. Excluding the 2013, the total value of payments was highest in 2019 at $1.6 billion from $1.34 billion in 2014. It was lowest in 2020. It says the open payment database administered by the Centers of Medicare and Medicaid required drug device makers and group purchasing organizers to report payments made to physicians. In other words, we have doctors, and many of them, 800-some thousand plus, being paid. Some of them making in excess of $1 million in short periods of time. From pharmaceutical companies and device maker companies, things like joint replacement, implants, like pacemakers, that kind of stuff. So you need to have the weapons at hand when you visit your doctor and ask why. Because this stuff is costing our population, you and me, buku bucks. And it's going to continue because the motivation is to make money. Who makes the money? Big Pharma makes the money. Device makers make the money. And in this case, some doctors are making money off of you and me. And when in many cases, a lot of these conditions can be lessened by changing our diet and exercising. I've got an article right in front of me from Tufts University, Exercise versus Drugs. For stroke, prediabetes, and coronary heart disease, physical activity seems to be as good as popping a pill. Doctors should consider prescribing exercise as well as medication for some common conditions, a new study suggests. It found that exercise affects outcomes about equally as well as prescription drugs for coronary heart disease, prediabetes, and stroke. The research did not specify which type of exercise worked best for the different conditions. The study was what is called a network meta-analysis, which allows researchers to compare evidence from many existing studies on different types of treatment for the same disease. The review examined 305 random control studies with 339,274 participants. We wanted to see how much evidence there is with rigorously designed studies on exercise versus the most commonly used type of intervention in medicine, medication. Says study co-author John Ioannidis, an adjunct professor of Tufts University School of Medicine and director of Stanford Preventative Research Center. The evidence suggests that exercise and many drug interventions are often potentially similar in terms of reducing mortality during rehabilitation after stroke, prevention of diabetes, and secondary prevention of coronary heart disease, according to the study published in October in the British Medical Journal. Exercise, not pharmaceuticals, provided better outcomes in patients rehabilitating after a stroke. In the case of coronary heart disease, prediabetes, exercise and drugs had about equal outcomes. He goes on in the study. At the end of the study, he says, I think we need more studies, in particular, far more evidence on exercise, Ioannidis says. He adds that there should be more studies on drugs, too, noting that many medications used by tens of millions of people have only undergone clinical trials, now get this, with 500 to 600 people. That's why a couple of weeks back when I had Dr. Ken Berry on my show, he said we're going to see all kinds of problems with the prescription drugs, the semaglutide drugs being prescribed into millions now in the next couple of years. All kinds of side effects from them. And they're going to come forward. There's nothing you'll be able to do because you know what? They'll pay out billions of dollars in settlements because they've made multiple billions of dollars in profit. Now, here's some more information and research for you and what this exercise can do for you. The PHA system, which I'm a proponent of and have been for so many years, is proving to be the most effective way to exercise. And the concept is to move around the body. You don't stay in one area at any one time. You go from upper to lower body. You get all these muscles pumping blood. Well, there's more proof in the pudding that does more than that. This is from the University of Houston. Researchers discover a muscle that can promote glucose and fat burning for fuel metabolism for hours while sitting. It can also have an effect on blood pressure. From the same mind whose research propelled the notion that sitting too much is not the same as exercising too little, comes a groundbreaking discovery set to turn a sedentary lifestyle on its ear. The soleus muscle in the calf, although only 1% of your body weight, can do big things to improve the metabolic health in the rest of the body if activated correctly. In other words, you sit there and you pump, your knees are bent, you pump up and down with your feet on your toes. Yeah, it's that simple. And Mark Hamilton, professor of health and human performance at the University of Houston, has discovered such an approach for optimal activation. He's pioneering what he calls the soleus push-up, which effectively elevates muscle metabolism for hours even while one is sitting. The soleus, one of 600 muscles, there's actually 696, in the human body is a posterior muscle, leg muscle that runs from just below the knee to the heel. Published in the journal Science, research suggests the soleus push-up's ability to sustain an elevated oxidative metabolism to improve the regulation of blood sugar is more effective than any other popular methods recently touted as a solution, including exercise, weight loss, and intermittent fasting. This is good stuff. Oxidative metabolism is the process by which oxygen is used to burn metabolites like blood sugar or fats, but it depends in part on the intermediate energy needs of the muscles when it's working. He never dreamed that this muscle has this type of capacity. It's been inside our bodies all along, but no one ever investigated how to use it to optimize the health. Until now, says Hamilton. When activated correctly, the soleus muscle can raise local oxidative metabolism to high levels for hours, not just minutes, and doing so by using a different fuel mixture. Muscle biopsies revealed there was minimal glycogen contribution to fueling the soleus. Instead of breaking down glycogen, the soleus can use other types of fuel sources, such as blood glucose and fats. Glycogen is normally the predominant type of carbohydrate that fuels muscular exercise. The soleus' lower than normal reliance on glycogen helps it work for hours effortlessly without fatiguing during this type of muscle activation because there's a definite limit in muscular endurance caused by glycogen depletion. As far as we know, this is the first concerted effort to develop a specialized type of contractual activity centered around optimizing human metabolism. He says here, when the SPU, that's the soleus push-up, was tested, the whole body affects a blood chemistry, listen to this, included a 52% improvement in the excursion of blood glucose and 60% less insulin required over 3 hours after ingesting a glucose drink. This is incredible. The new approach on keeping the soleus muscle metabolism humming is also effective in doubling the normal rate of fat metabolism in the fasting period during meals, or between meals, reducing the levels of fat in the blood, triglycerides. This is groundbreaking. And all it is, if you're sitting, ladies and gentlemen, He calls it the soleus push-up. I call it just movement. You sit there with your knees bent and you pump up and down on your toes. You're not even using any resistance, just the weight of your lower legs, and you're getting this activation going. Now, there's also studies that support the same activation in blood pressure and predict dementia risk. Same muscles. This can be groundbreaking. So any seniors that are out there listening to what Dr. Fitness has to say. Don't sit in the chair and do nothing. Sit in the chair and come up and down on your toes. Now, the concept of this kind of training, we refer to this as peripheral heart. Getting all these little muscles to serve as secondary hearts, pumps. And the soleus is one of them because there's so many blood vessels that go through that muscle. There's a squeezing action to push that blood and lymphatic fluid back up to the heart and lungs to get you fresh oxygenated blood. Also is involved in burning glucose and fat at a resting state in incredible amounts from very, very little. So when you come in to see us, this is some of the things that you learn. How this type of activities is so far superior than CrossFit, the high-intensity interval training, because you're training not only these big muscles, you're training these little muscles, like the calf muscles, like the soleus, like the neck. Yes, all of these. All these 600-plus muscles in the human body, which are secondary pumps. It helps recovery, helps mobility, it helps movement, it helps life. I sound pretty good for a guy almost 70, don't I? Sound full of spry and a lot of energy because I work at it. I'm not sitting all day long, staring at the TV set or looking at the clock, waiting for tomorrow to come. You can do exactly the same thing, ladies and gentlemen. You don't get this in your local fitness center. You don't get this by online stuff. You get this with somebody who can make you do this and get you motivated. Even if you have different things that are going on with you. You may have had joint replacements. You may have had shoulder surgery. You may have high blood pressure, or you may be a diabetic. These are all things that can be beneficial to you. But the first thing you've got to do, because I hear all kinds of commercials on television, on this radio station, for all these different drugs people are taking now to lose weight. That's not the solution. That's a Band-Aid. The solution is lifestyle. The lifestyle comes from the first move that you make is to pick up your phone. Send a text. Make a call. That's the first step. Next step is to do something. And understand, lifestyle change is not something you do for a week or 2 weeks or a year. It's the rest of your life. All right, phone number here at the studio is 602-260-5394. And we're talking about lifestyle. And this is from Mayo Clinic. Mayo Clinic Minute. Relationship between food, disease, stronger than you may think. The phrase, you are what you eat, is commonly used in conversations about health and the connection between food and the body. Eating an unhealthy diet can have serious consequences and can increase someone's risk of dying from heart disease, stroke, and type 2 diabetes. In this Mayo Clinic Minute, Dr. Stephen Kopecky, a preventive cardiologist in Mayo, discusses the relationship between food and disease. Things like smoking and genetics put us at a risk for developing different diseases, but neither are the biggest risk factor. Nutrition is the number one cause of early death and early disease in our country and the world, says Dr. Kopecky. What does that say? He says that genes for disease will increase your risk by 40%. Boy, I hear this all the time. It's in my genetics. That's why I have high cholesterol. But having a bad lifestyle for disease will increase your risk by 300 to 400%. What does that say? He says 57% of calories we consume every day in this country are ultra-processed foods. So this thing where, well, it's in my genes, I'm going to get it. 300 to 400% is from what you eat. 30 to 40% is what your genes say. So the excuse is, well, I'm overweight because my folks were overweight. I've got high blood pressure because my folks had high blood pressure. I'm a diabetic because my folks were diabetics, or it runs in my family. Or cancer runs in my family. So I get cancer too. It's 3 to 4% is what you eat. Increases your risk of disease. 30 to 40% from genetics. You can't change the genes, but you can change what you eat. And unfortunately, the information we're getting on nutrition, even though it's better in the last couple of years because we have more and more people stepping forward with the research being done on low-carb consumption. Some of them call it keto eating or keto diet. Some call it carnivore. I call mine low-carb. All the same, pretty much close. You control what you put in your mouth. Control the arm. The arm puts the food to the face. The jaws start to chew what you eat. Goes in your stomach, it's processed, and it's turned into chemicals. Your body does with it what it does with it. So it just makes sense. And when you look at the high carbohydrate diet that most Americans are consuming, now you understand why we have an explosion in obesity in this country. In fact, statistically, according to the CDC, Center for Disease Control, 8 out of 10 Americans over the age of 55 are diabetic or pre-diabetic. 8 out of 10. So there's no motivation by big pharma or big food to make you healthy. Oh, big food will make foods for you to eat. They want you to buy their stuff. But they'll make foods that you shouldn't eat as well because they want you to buy their stuff. Then the drug companies, they'll make a drug around to treat what you've caused from eating the stuff that you shouldn't be eating. It just makes sense when your doctor says you're a type 2 diabetic or your blood sugar is too high. What is blood sugar? It doesn't come from eating a stick of butter. It comes from eating carbohydrate foods, which Americans eat in overabundance. Go to your grocery store, walk down the aisles. Packages and packages of highly processed carbohydrates. Packages. In fact, most of your rows in a grocery store are dedicated to processed foods. From breads to cereals to drinks. Processed foods. Even in the freezer aisle, processed foods. Highly processed carbohydrates. The only one benefiting is Big Pharma. And what I brought up earlier is some of these doctors who get kickbacks, and that's what they're called. Making buku bucks from treating the conditions that we've caused ourselves from our nutrition or lack of it and lack of exercise. Just as simple as sitting in the chair, seniors, people in my age group, and pumping up and down on your toes while you're sitting there all day long. It can be effective in helping to lower your blood sugar, your blood pressure, and increase risk of dementia. Yeah, just by simply doing that can help. Now think about all the other things that you can do that can help, like changing your diet. Or getting yourself on a program, an exercise program that helps to deal with all your issues of why you're not active. Loss of muscle strength. Loss of muscle mass. Stiffness and achiness from sitting in a chair all day, looking at the wall or watching TV. I don't know about you, but I love my life. I love my wife. I love my children. I love my grandchildren, and I want to spend time with them. Spending time doesn't happen when you're stuck in a chair, because you've created that environment. And it doesn't take a lot of time either. I tell people who come in to see me, all you need to do is do 20 to 30 minutes of exercise 2 to 3 days a week. That's it. If you can do it every day, that's even better. You don't have to be in the gym for an hour and a half, 2 hours. You don't have to be stretching to try to touch your toes to your nose. You need movement. And that movement comes with a structured program that you follow through with. Because a lot of people, when they exercise, they have no idea what they're doing. Just they don't. Just remember, muscles move bones. Bones don't move unless the muscles can move the bones. Strong muscles that are balanced between the front and the back of the joint increase movement, decrease injury, because the joints are more stable. Anybody who tells you, oh, go do Pilates or do some stretching class, don't listen to that bull. You need movement with resistance. Resistance helps to build muscle. Muscle protects you from injury. Muscle pushes blood. Stretching doesn't do that. Movement does, with resistance. As much as squatting in and out of a chair. Not once, not twice, but multiple times throughout the day is beneficial. But a structured program where you're working all the muscles, including the critical core muscles that control the arms and legs during movement when you're up and moving around. The abdominals, the lower back, the muscles between your shoulder blades, the neck muscles that hold your head up. The soleus muscle, which is a postural muscle. Critical. Those need to be exercised. And you don't do it by not doing anything or by stretching. You need movement. Someone asked me the other day, why do you in the neck exercise? Yeah. Why are we exercising the neck? Because the head weighs 16 pounds. It's a bowling ball. If it weighs 16 pounds, you need to strengthen it because it holds the head up, which holds the brain in it. Of course, if those muscles weak, you feel between the shoulder blades down the lower back. Here we go. Of course, let's not forget about the hips. So here's what you can do. You want to get yourself in the right program. Get yourself on eating like Lance. Eat like Lance. To give you a good idea, I eat about 50 to 70 grams of carbohydrates a day. And I'm really active. This is from Dr. Conrad Grosser, cardiologist and interventionalist. Okay? Interventionalist. Is that how you say it? Interventionalist. Never heard that word before. Anyhow, it's there. It says there, the benefits of low-carb diet for blood pressure. I've been saying this all along because let me tell you what my readings were yesterday. I do these every day. Let's see here. There we go. Let's see. Yesterday morning after exercising, 115 over 81 with a pulse of 76. The day before that, 110 over 73 with a pulse of 79. The day before that, 115 over 8. And I'm 69 years old. Anyhow, and I eat low carb. I don't call it keto because I don't go down to 20 or 30. Okay, I believe in having some vegetables. I like big salads, a little bit of fruit, offers some variety. As I said, according to a recent report, a low-carb diet can be more effective, and same applied with keto, in carnivore, in reducing blood pressure than medication designed for weight loss. So following a low-carb diet was twice as likely to experience a reduced blood pressure compared to those taking weight loss pill, a diuretic. A recent research provides additional evidence to support the health benefits associated with low-carb eating. Among those benefits is the improvement in high blood pressure, which is often dubbed the silent killer. Here we explore the insights gained from this study and how a low-carb diet can possibly impact blood pressure. The latest controlled non-randomized study assessed the cardiovascular risk factors in participants with type 2 diabetes. When a continuous care treatment plan that included nutritional ketosis was followed, that's low carb, it reduced the risk of cardiovascular disease after 1 year. It also revealed that the tight control over blood pressure reduces the risk of death in patients with type 2 diabetes. Specifically, it reduced the risk of stroke, microvascular, and cardiovascular disease complications. Right there. You know how it does it? Less inflammation in the arterial walls. Your body dumps sodium. When you eat less carbs, your body gets rid of the salt. And what do you do when you go to your doctor? You don't eat the salt. Doesn't talk about eating low carbs because if you cut the carbs down, your body dumps the extra sodium. Sodium is an essential electrolyte. In other words, you need it or you die. I do not watch my salt. At the same time, I don't sit there and pour salt all over my food. I just don't sit and get become anal over this stuff by, I can't have that. Any of this got salt in it. I watch my carbs, and you dump the salt. That's why the first thing you notice when a person cuts their carbs is they lose a few pounds of water weight because they're getting rid of sodium. Now, you can listen to all the stuff I tell you every week and the stuff I've told you today, but in order for this to benefit, you need to react to what I'm saying. I hear tons of commercials for weight loss stuff. All these things giving you shots and pills and stuff. That doesn't make lifestyle changes. Lifestyle changes come from your commitment to do something and get help doing it. To be accountable. Change what you're eating. Change what your habits are when it comes to exercise or lack of. Be accountable.